Today we'll be discussing about olfactory pathway. Olfaction is a very important sense because can you imagine living without smelling your favorite food, favorite biryani or your favorite perfume? So olfaction is via the first cranial nerve, that is the olfactory nerve. Initially I will outline the pathway and then I will describe the each segment. So first you have the olfactory epithelium in the nose. From the olfactory epithelium there arises olfactory nerves. Olfactory nerves enter into the anterocranial fossa in the olfactory bulb. From the olfactory bulb, there is olfactory tract that goes into the olfactory cortex. So, where is the olfactory epithelium present? The olfactory epithelium is present in the superior part of the nose, that is in the superior turbinate, cribriform plate, posterior superior part of the lateral wall of nose, etc. So, the olfactory epithelium is a specialized neuroepithelium. There are a lot of cells in the olfactory epithelium. The most important cell is the olfactory sensory neuron. It is a specialized neuroepithelium in which the cell body lies close to the surface. The dendrites of the olfactory neurons extend into the nasal cavity and end in knob-like structures which contains lot of basal bodies. From this knob-like structure, cilia extend into the mucus of the olfactory epithelium. And from there, the odors are picked up. So when the air enters the nasal cavity, the odor is picked up by these receptors. And the axons of these olfactory neurons continue as the olfactory nerve. So there are around 10 to 20 million olfactory receptors, and these axons form in small bundles known as olfactoria and become olfactory nerves. So there are around 20 to 20 olfactory nerves in each side of the nostrils. The olfactory nerves pass through the cribriform plate of ethmoid bone and enter into the olfactory bulb situated in the anterior cranial fossa. So the olfactory bulb is a club-like structure. It contains a constellation of neurons and there are 5 layers of synapses. It contains many cells like the mitral cell, tough cells, granule cells, periglomerular neurons, interneurons, etc. So the olfactory nerves, which are axons of the neurons on the olfactory epithelium, terminate at the olfactory bulb, and there they synapse with the dendrites of the mitral cells and tough cells, forming clusters called glomeruli. So you know that there is glomeruli in the olfactory pathway also. And the axons of these tough cells and mitral cells continue as the olfactory tract. They pass backward on the basal surface of the frontal lobe into the cortex. Before the optic chiasma, they divide into a lateral olfactory stria, medial olfactory stria, and intermediate olfactory stria. So the lateral olfactory stria goes into the primary olfactory cortex, that is the area of the uncus situated in the temporal lobe of brain. It is also associated with the association olfactory area, such as the parahippocampal gyrus, entorhinal cortex, the amygdala, etc. The lateral striae has connection towards the hippocampus, amygdala, and limbic system. That is why you have memory and emotions associated with smell. When you smell of a special biryani, you think about a person with whom you shared the biryani, or a certain perfume or a certain smell makes you remember about a certain place. So all this is because there is connection of the olfactory pathway to the hippocampus, limbic system, and amygdala. The medial stria enter the ipsilateral olfactory nucleus and they crosses over at the level of anterior commissure into the opposite side of olfactory bulb. So there is bilateral relay in olfactory pathway. The medial stria is also responsible for the autonomic responses in relation to olfaction. That is, you're walking along the road and a strong smell of biryani or a strong coffee decoction, filter coffee smell is coming from a cafe or a shop. Your mouth will water and you feel some kind of hunger. These are all because the olfactory pathway has autonomic relay also. Medial olfactory stria divide into a medullary stria and an olfacto-hypothalamic tegmental bundle. The medullary stria has connections with the superior and inferior salivatory nucleus leading to salivation. The olfacto-hypothalamic tegmental bundle has connection with the dorsal nucleus of the vagus, causing gastric secretion. The intermediate bundle terminates at the anterior perforated substance. What is the chemical pathway? That is, when an odorant molecule binds to the receptor, there is activation of G protein. So the G protein couple, G protein, activation of enzyme adenylate cyclase, then activation of cyclic AMP, and there is influx of sodium and calcium into the cell, causing an electrical signal, and that is transmitted in the olfactory. Now, what are the specialities of the olfactory pathway? It is a sensory afferent pathway only, paired like all the cranial nerves, which has only 2 neurons between the sensory receptor and the primary cortex. So embryologically, olfactory nerve is a part of the forebrain, so it is a component of CNS. It is not myelinated by Schwann cells, but it is ensheathed by olfactory ensheathing glia. The olfactory cells are replaced every 30 to 40 days. New olfactory cells are formed. It is formed from the stem cells in the basal layer of the olfactory epithelium, and this is regulated by special growth factor. And the olfactory pathway do not project via thalamus. How do you test for olfaction? You can use your normal sniff bedside test. You can give an order to the patient and ask the patient to recognize the order. You have to ask the patient to close their eyes and you have to test both the nostrils. Close one nostril and test one side, close other and test the other side. Make sure that you do not use any irritant or pungent smell. When you use an irritant or pungent smell like ammonia or something, what happens is the trigeminal nerve is stimulated, not the olfactory nerve. So use a pleasant smell like coffee. A quantitative standardized test is University of Pennsylvania Smell Identification Test or UPSIT test. It contains 40 orders. In scratch and sniff method, you can test and identify the sense of olfaction of the patient. There is also brief smell identification test. It is same as the UPSIT test, but it has only 16 orders compared to 40 orders in UPSIT test. So what are the problems with olfaction? Anosmia. Anosmia is loss of smell. So the most common condition that causes anosmia is your common cold. When you have a cold, you don't feel like eating anything. You don't have any smell. So any viral upper respiratory tract infection can cause loss of smell, which is temporary. Other cause of loss of smell are trauma, any injury to the cribriform plate, head injury, any tumors of the nose, any tumors of the olfactory nerve, any brain tumors compressing on the olfactory nerve, meningioma, olfactory neuroblastoma, intestinal neuroblastoma, etc. Also aging. Aging can reduce the sensation of smell. Also neurological disorders like Parkinson's, Alzheimer's, multiple sclerosis. What is Kallmans syndrome? It is a congenital condition causing anosmia. It is hypogonadotropic hypogonadism. That is, there is defective in the formation of the olfactory epithelium or olfactory bulb, and also defective migration of the GnRH producing neurons. So patient will have anosmia, cryptorchidism, associated renal abnormalities, diabetes. There can be associated sensory neural deafness also. It is an autosomal dominant condition with variable penetrance. What is parosmia? Parosmia is distorted sensation of smell. That is, you feel a pleasant smell as a foul smell. This usually occurs when you are recovering from a viral infection or a cold. Especially, you can know that post-COVID, a lot of patients had anosmia and parosmia. That is, they are feeling good smell as bad smell. Some people had constant smell of onion or sweat in the nose. All these are because of the time taken for the olfactory neurons to get repaired. Also, parosmia can be seen in certain antibiotic therapy. Streptomycin therapy can cause parosmia. What is phantosmia? Phantosmia is olfactory hallucination. So olfactory hallucination is there is no smell, but you can feel a smell. It can be a pleasant smell or a foul smell. It can be seen in temporal lobe epilepsy, certain migraine auras, in certain people who smoking, and certain exposure to certain toxic chemicals like lead, mercury, certain antibiotics. Also in Parkinson's, Alzheimer's also you can have phantosmia. What is hyperosmia? Hyperosmia is increased sensitivity to smell. A small smell itself you feel as a big smell. That is usually seen in pregnancy. So summary, olfactory epithelium, olfactory nerve, olfactory bulb, olfactory tract. The lateral olfactory striatum, primary olfactory cortex, uncus temporal lobe, medial olfactory striatum crosses over